When in Toronto, guests of the Dini Petty Show stay at the Ramada Renaissance Hotel, where value and comfort are assured. Ramada International Hotels and Resorts, a certified preferred employer.
We would like to invite you to come down and join us sometime and be part of our studio audience. It is free, it is fun, and all you have to do is pick up the phone and call Karen at 299-2370. Reserve yourself a seat for your favorite show. If you're a woman who is on birth control pills, and if you have problems with your periods and they gave you those because you have cramps or some PMS, it's going to make it worse?
In a third of the cases.
A third of the cases?
Yeah. A third of women on the birth control pill will get vaginitis and will get worsening of PMS symptoms. And
this, which leads to Candida, or the Candida started it, or it's all...
Yeah, it can be growing more yeast in your intestines. It's a vicious cycle, but I guess it's part of the way our society is. We think pills will fix everything. Women can learn natural birth control methods. In the building where CRIF and I practice, the CRIF is the Candida Research and Information Foundation, there is an organization called Fertility Management that teaches women how to follow their cycles so they know when they ovulate and they know when to not have intercourse.
Okay. We've covered a tremendous amount of information here today. If you would like some further information and you want to know about Candida, we're going to give you an address now. And this address is... okay, how about a phone number? The Candida Research and Information Foundation. This is obviously it's a Toronto number. Area code 416, which is Tirana. 656-0047.
And
656-0047.
Sorry, Dini.
It's okay.
We're a charitable organization. People can make donations, and perhaps somebody out there who wants to donate research funding to CRIF, we could be doing tremendous work if we had the funding.
You said that you do this blood test, but I gather very few, you know, unless you live in Toronto, you're not going to get this, are you, in this country?
Apparently, I'm one of the 1 or 2 people in Canada that's doing it because I do it on my own.
You don't use a blood test?
No, I don't.
You use other methods to ascertain?
I use other methods, the more electronic, computerized methods. But as we were saying before, if you have a list of symptoms half a mile long, one's
What are the overwhelming ones, though, Jeff? When somebody comes to see you, what are the first questions you ask if you think it's Candida?
Fatigue.
Okay.
Brain fog.
Brain fog. That's the...
Memory concentration.
The brain fog is like, you want to get the... But it's just... Yeah.
It's just like a cloud there, and you feel like you're going senile at the age of 25 or something. And digestive problems, gas, bloating, that's often a common one. It could be circulation. Cold hands and feet are very common. Okay. And often urinary problems such as urinary infections or urinary urgency and reproductive, PMS related, and so on.
All right, so if you have those symptoms, you should check that out. If you're children have taken antibiotics, you should try to get them to have some acidophilus. Now, we didn't talk about how much you're going to give them, so you should call your doctor and say, look, I heard this, I want to give the kid because he's had antibiotics. How much? You're going to need somebody who's interested in sort of natural health. Yeah. But GPs could help you with this if they're, a lot of them have that bend.
As you mentioned at the outset of this segment, doctors really haven't been educated in this process, and I'd like to make another plea to people. If you're interested in alternative medicine or what we've been talking about, perhaps we should be informing our health ministries, our Minister of Health in all the provinces of what we want. They're only doing what they think we want done to us, mainly under the College of Physicians and Surgeons, which are a wonderful body of people, but they're using drugs and surgery and radiation for treatments. Alternative medicine is not taught in medical schools. It could be.
All right. I would like to thank you, Barbara, for coming. If, you know, I mean, your story was that bad where literally life was not worth living anymore. And obviously, as I said, you look so incredibly wonderful and healthy. So if you are having problems and you can associate, get these things checked out. You have the address. We thank you for joining us. We'll see you next time. Thank you all very much. Thank you.
She's a gutsy public defender with a personal life as demanding as her busy job. Cagney and Lacey's Sharon Gless stars in The Trials of Rosie O'Neill, a promising new drama series that dares to be different, beginning Saturday night at 9 on CFTO TV.